Hi, I'm Kay Gloria.
Hi, I'm Shayengo.
I am Francis Gonzalez.
I'm Milena Gonzalez.
And I'm Sweetheart Angela Gonzalez.
And
We
we
are
are
second
second
year
year
student
student
nurses
nurses
from
from
the
the
University of Santo Tomas College of Nursing.
And in this video, we will be talking about
For the science of true and false labor.
Labor basics and stages of labor.
Management of labor pain.
what happens during labor and delivery in a Philippine setting.
And the EINC protocol.
So stay tuned.
Sit back.
Relax.
And enjoy this video.
Roll VTR.
Ang sakit. Manganak na yata ako. Teka. Parang hindi pa pala. Charot lang pala. And that is a video showing the awareness on the science of true and false labor. So, before we begin the discussion of the science, what is labor nga ba muna? So, labor is the process wherein the baby exits the womb of the mother, and that is made possible with the help of the contractions of the muscles inside the womb. For the true sense of labor, meron tayong contractions or yung pagtighten ng muscles inside the womb or sa uterus. So, mas dumadalas siyang mangyari and mas nagiging intense siya over time habang tumatagal. So, continuous siya, so there's no way to stop it or make it go away. Usually, yung pain, magsisimula yan sa likod, then later on, pati na rin sa harap o sa may abdominal area, sa may tiyan. Next naman is yung tinatawag natin show. So, pwede kayong may makitang ganito na galing sa vagina nyo. Yung consistency niya is parang stretchy na medyo thick. So, the color of it ranges from brownish to pale pink. Pwede siyang i-compare sa slime, something like that. Next naman is yung rupture of membrane o yung tinatawag nating pagputok ng panubigan. So, ito yung sudden gush or yung biglaang paglabas ng clear fluid from the vagina. Pwede siyang pumutok just before the actual labor or anytime during the labor. So, once na ma-experience nyo tong signs na to, remember na huwag magpanic. Instead, prepare yourself for the process of labor and sa delivery mismo. So, inform nyo na yung family nyo, yung relatives nyo, or sino man yung kasama nyo by that time. Then, go to the hospital. Kaya naman, kapag mag-home birth ka, it is better to inform your birth attendant as soon as possible. So, for the false signs of labor, we have this, what we call the Braxton Hicks contractions. This is also called false labor as it gives pregnant women the false sensation na they are in actual labor na. Yung iba na hindi aware dito, once na ma-experience nila to, pumupunta agad sila sa hospital only to find out na false alarm lang pala. And isa yun sa mga dahilan why knowing the signs of false labor is important. Next naman, Braxton Hicks contractions is also called practice contractions. Why? Because you can practice your breathing control when they happen and prepare yourself for your delivery. You don't have to worry as they commonly happen, especially during second or third trimester of your pregnancy. And they won't result or cause delivery. Mas makaka-experience ka pa nito kapag pagod ka, stressed ka, dehydrated, o kaya pag malapit na yung due date mo. Usually, they come at random times. They are not continuous unlike true labor contractions. So, pwede silang mahinto o mag-disappear naman with movements. The pain is weak lang o kaya pwede siyang magsimula ng medyo masakit then pahina ng pahina. And usually, mararamdaman lang yung sakit sa may abdomen. And the pain can be compared with the menstrual cramps lang. So, medyo similar lang sila. Okay? So, like what I have mentioned earlier then, the false contractions may be stopped or relieved. And that may possibly happen by walking, changing in position. For example, you're lying sidewards facing your right. So, you may try changing to the left o kaya sit ka muna. So, pwede rin try to drink some water, relax yourself, place a warm compress sa may abdomen again, and then pwede din yung try to urinate then. to empty your bladder. Okay? And that's it for the signs of true and false labor. If you want to know more about the stages of labor, keep on watching.
Oh my gosh, this is it. The baby's coming. Janelle, it's time. The baby's finally coming. Mommy, get ready. But before that, here are some labor basics and stages of labor. The most common way of birth is vaginal birth with pain medications, such as your epidural. These medications are anesthetics and they help you feel less in your lower body. You'll have to give birth in a hospital if you want an epidural or pain medications. The next most common way is the cesarean section or C-section. Depending on your doctor, you may have a planned C-section or an unplanned C-section if your vaginal birth does not go smoothly. This is performed in a hospital since it is a major abdominal surgery. The last common way of birth is vaginally without medications, and this is called your spontaneous vaginal delivery. This is ideal because it is natural and it can be done in a hospital, birthing center, or even at home. So how long does labor last? So the duration of labor is actually very unique to each woman. For first-time mothers or primigravida, labor lasts about 10 to 14 hours. But for mothers who have already given birth before or multigravida, labor lasts significantly shorter, around 6 to 8 hours. Many women find it best to be mentally prepared for a longer labor and then be glad if it ends up shorter. So who will be with you in the delivery room? So this is the chance to get to know your healthcare team. This consists of your doctors or midwives, labor nurses, specialists, and depending on hospital policy, your companion. A doctor or midwife is someone you have been visiting throughout your pregnancy to monitor your progress. You may also think that having a partner in the delivery room is a given, but it really depends on hospital policy if they will allow a companion. Then we have your labor nurses. They are responsible for communicating between you and the doctor or midwife. They are also responsible for paperwork, monitoring, vaginal exams, and etc. They will be assisting you during delivery as well. Then we have the specialists. We have anesthesiologists if you requested any pain medication, OB technicians to prepare materials needed for your delivery, pediatricians and pediatric nurses for your baby, and your medical students, yours truly, nursing students, and OB residents. Common places for birth are at the hospital, a birth center, or at home. The most common is the hospital since they have the medical technology and resources that is most often not provided at birth centers or at home. They provide a more standardized care and is led by physicians. Birthing centers provide a more individualized care. This type of setting looks more like a home and provides various choices of pain relief such as tubs, showers, or birth balls, which are drug-free. Lastly, giving birth at home is highly tailored to your needs and preferences. It allows you to rely on your body's healthy processes than technology. However, the facility and personnel might not always be immediately available. Overall, depending on your pregnancy, you can plan accordingly to where you plan to deliver your baby. However, the most ideal place to give birth is at the hospital. So when should you go to the hospital? Typically, you should go to the hospital when you're in the active phase of labor. I'll discuss more about this later on. But timing contractions are key. If this is your first baby, you should observe contractions that last 40 to 60 seconds every 3 to 5 minutes. If you've given birth before, you should observe contractions that last 40 to 60 seconds every 5 to 7 minutes. Before going to the hospital, you should always have your hospital bag ready. Depending on your provider, they may provide you with a different list of things to bring, but the most common are these. For your baby, you should bring a going home outfit, blankets, baby socks, baby book, and a rear-facing car seat. For the mother, you will need identification, insurance card, hair tie to keep hair out of the way, robe for easy skin-to-skin contact, slippers, a nursing bra, maternity underpants, toiletries, and going home outfit. For partner or companions, your phone, charger, toiletries, light snacks, water, a button-up shirt for skin-to-skin contact with the baby, and blankets or cover-ups for mommy. Stages of labor. So there are 3 stages of labor. The first stage is cervical dilation, the second stage is the delivery of your baby, and the third stage is the delivery of the placenta. The first stage consists of 3 phases: the latent, active, and transition phase. Remember the active phase from earlier? I'll be explaining now why we should go to the hospital at this time. Latent phase. So during the latent phase, you can feel alert, happy, and have mild anxiety. Contractions cause minimal discomfort, and you can manage this with controlled breathing. You may also have some brownish or pinkish discharge. So your cervical dilation at this point should be 0 to 3 centimeters, and this phase can last for about 8 to 10 hours for first-time mothers and 5 hours for those who have given birth before. So your baby is starting to descend into the birth canal. Uterine contractions are mild and short, irregular, and last 20 to 40 seconds every 5 to 30 minutes. At this point, you should still continue to walk about, do last-minute packing, and if you have children, get them ready for your departure and leave instructions for their caretaker. Active phase. So during the active phase, you may feel alert, a little demanding, excited, frightened, and concentrated on labor. Contractions are growing stronger and longer, there is increased vaginal secretion and pinkish or bloody mucus, and during this stage, your water may break. So your cervical dilation at this point should be around 4 to 7 centimeters. The active phase can last for about 3 to 6 hours for first-time mothers and 4 hours for those who have given birth before. Your baby is continuing to descend into the birth canal, and uterine contractions are more regular, last 40 to 60 seconds every 3 to 5 minutes. This is why you should go to the hospital at this point, because you don't want to be too late yet too early. You can walk around if your water hasn't broken, but if you're confined to the bed, you can change positions into side lying or upright so that you can be more comfortable. You can also have light snacks and ice chips, but not too much. Transition phase. So during the transition phase, you may feel irritable since contractions are reaching their peak intensity. You may experience intense discomfort along with nausea and vomiting, and also bloody mucus discharge. You may also feel the urge to push. Your cervical dilation should be 8 to 10 centimeters, and once you're fully dilated, you're about to give birth. This phase can last for 2 hours for first-time mothers and 1 hour for those who have given birth before. So uterine contractions are very strong and regular, and they last 60 to 70 seconds every 2 to 3 minutes. So keep in mind not to push unless you are fully dilated and you get the go signal from your doctor. Use relaxation techniques such as controlled breathing and start preparing for delivery. So now that you've passed the first stage of labor, let's go on to the second. So during the second stage, you may have the urge to push, temporary nausea and shivering, and pressure on the perineum since crowning of the baby's head causes a bulging perineum. So you're going to deliver your baby. So this stage can last for 3 hours for first-time mothers and 2 hours for those who have given birth before. You should push with each contraction so that your abdominal muscles will aid your uterine contractions. So you can tell if you're properly pushing if it feels like you're pooping. Never forget to follow the doctor's instructions on pushing because they may tell you to stop pushing at one point to avoid tearing. Clinical fact: perineal massages to prevent tearing and pressure on the fundus to aid pushing is not used anymore since there are low quality of evidence that it actually works. Congratulations, mommy! So your baby is delivered, but we're not done yet. So we have to deliver the placenta, and this happens in 2 stages: placental separation and placental expulsion. So placental separation happens 5 minutes after birth, and contractions continue, and the placenta separates from the contracting wall. So don't worry if you have blood loss because this occurs normally. So placental expulsion is when the placenta sinks to lower uterine segment or upper vagina. So the placenta is expelled by gentle pulling on the cord. This stage should last for about 5 to 20 minutes, and you should just relax and focus on skin-to-skin contact with your baby. Inform the nurse if the placenta is important to you and if you would like to keep it. If it is, make sure to understand and follow infection precaution guidelines and hospital policy. And those are labor basics and stages of labor. Do you want to know tips on how to manage your labor pain? Keep watching!
usually how labor goes. But kidding aside, here are ways on how to manage your pain during labor. But before we dwell on that, we must first define pain. Okay, so when we say pain, we define it as a sensation of discomfort. Okay, so pain, we can say that it is subjective, since it is a subjective phenomenon wherein when a person says that she is experiencing pain or it is painful, that then we can say that the pain is present, right? And also it is individualized, meaning we may not have the same pain tolerances as others. Okay? So basically, pain is a basic protective mechanism that alerts a person that something threatening is happening somewhere in your body. Okay? Moving on, a pregnant woman, along with the support people in her life, must be educated about the numerous comfort and pain relief strategies available and make sure that they understand the choices available to them. So we divide this part into two sections. So the first one is non-pharmacologic pain relief measures, or we manage the pain without any medications. And the other one is pharmacologic pain relief measures, wherein we manage the pain with medications. Okay? So here are some non-pharmacologic pain relief measures. So the first one is relaxation and breathing techniques. So this is a type of distraction technique wherein you direct your attention or your mind away from your current emotion or what you're currently feeling. So this is done since a woman cannot concentrate on pain while concentrating on relaxing and having slow-paced breathing, right? So during the first stage of labor, start with slow, deep breath as your contraction starts, and then slowly breathe out, releasing all the tension from your head to toes. Okay? So slowly inhale through your nose, and then pause, and then exhale slowly through your mouth. So each time you exhale, focus on relaxing a different body part. Okay? So the next one is heat or cold application. So most of us, if not all, are aware that this type has always been used for pain relief after injuries such as minor burns or strained muscles, right? So it is only actually lately that their use has been investigated as effective ways to help relieve the pain of labor. So if you or other woman is having a back pain, an application of heat to the lower back by a heating pad or instant hot pack or warm moist compress is extremely comforting. Okay? So if you're going to heat pads in the microwave, make sure that you test the temperature first on your forearm before applying it in your perineum. Okay, so sucking on ice chips to relieve mouth dryness is also helpful and refreshing. So next one is yoga. So yoga or exercises which consist of deep breathing exercises may be helpful in reducing the pain of labor through its ability to relax the body and possibly through the release of endorphins. So yoga may help women shorten the duration of the labor, help calm and relax the mind and body during labor, and also empower women in labor to trust their ability to breathe naturally. The last one is bathing or hydrotherapy. So standing under a warm shower or soaking in a tub of water is another way to apply heat to help reduce the pain of labor. So the temperature of water should be at 37 degrees Celsius. There are some times wherein labor experiences may be so intense and overwhelming that it is necessary to administer analgesic or regional anesthetic. So, the goal of medications used during labor is to relax a woman and relieve her discomfort, and yet having minimal effects on the fetus, on uterine contractions, and her pushing effort. So, it is really important to do regular assessments of maternal and fetal responses to the administration of systemic medication. Okay, so analgesic is one of the pharmacologic management of pain during labor as well as in birth, wherein it reduces or decreases the awareness of pain. So anesthesia as well causes partial or complete loss of pain sensation. Okay? So during labor, the medication is injected into the lumbar area, which is the lower part of your spine, and if it works properly, then you will no longer feel the pain in the lower part of your body. So in conclusion, the best approach to pain management for women in labor is to always aid pharmacologic intervention with a complementary or alternative therapy measures, just like what I've mentioned earlier. Okay? So for example, an intramuscular analgesic can be linked to breathing exercises to make both more effective. And that's how you can manage your pain during labor. Ever wonder what is happening during labor and delivery? Did it ever cross your mind how things work in a local setting? Let's find out.
Okay, Mommy, lalabas na po si baby. Pairi po tayo. 1, 2, 3. Okay, isa pa po. Papush pa po, ha. 1, 2, 3. Go! And that's what happens during labor and delivery here in the Philippines. Interesting, isn't it? Culture really does play a factor in the delivery of a pregnant woman, no? For today, I will be discussing to you about what happens during labor and delivery here in the Philippines. So for today's discussion, our topic is entitled Baby Out. So for today's lecture, I will be talking about the different mechanisms of the second stage of labor. I will also be discussing about the different methods of labor and delivery here in the local setting. And finally, I will be discussing about the different clinical facts and patient responsibilities that you need to know. Now, we shall talk about the different mechanisms of the second stage of labor. So to make things simplified po, I have chosen different observations that the pregnant mother can make upon delivery. So what do we expect? So first, there is what we call the fetal expulsion. So ano nga po ba yung tinatawag natin na expulsion? So in this phase, there is a widening and dilating of the cervix to allow passage of the fetus upon birth. Second, nangyayari po yung tinatawag natin na crowning kung saan nagiging mas visible pa ang ulo ng baby in the birth canal. And finally, there is also what we call contractions, which can range from mild to severe to allow the facilitation of the labor. Moving on, I shall talk about the different methods of labor and delivery in the Philippine setting. So for this part of our discussion po, I have chosen to present the different alternatives that the pregnant mother may consider upon childbirth. So to begin, we have first the most common, so to speak, of admitting oneself in the hospital or in a lying-in clinic to facilitate delivery. Second, we have this home birth from the name itself, wherein the mother can choose to give birth in the comfort of her own home. However, there are certain instances wherein home birth shouldn't be practiced because the woman may be experiencing a high-risk pregnancy because she is diabetic or is suffering from high blood pressure po. Then lastly, we have the so-called the water birth, wherein the woman giving birth is in a warm tub filled with water. Then again, as I have mentioned, this is not practiced for women with high-risk pregnancies and should be stopped if complications arise. Para po sa ating mga clinical facts, narito po ang ilang mga impormasyon. So sinasabi po nila na during the stage of labor, apprehension is more evident in pregnant women. So ano nga po ba ang tinatawag natin apprehension? Yung apprehension po ay ang feeling ng pagkakaba o pagkatakot sa anumang posibleng mangyari. So normal lang po ito na makita lalo na po sa ating mga first-time mothers na mga anak pa lang. Aside from that, meron din pong sudden increase in show. Yung show po na ating tinatawag ay ang anumang vaginal discharge na lumalabas sa ating ari. Nagkakaroon din po ng sudden urge to defecate o yung parang nandudumi po kayo. Nangyayari po ito dahil sa pressure na nangyayari sa ating balakang. At ang panghuli ay nagkakaroon po ng sudden rupture of the membranes and the bulging of peritoneum o yung pagputok po ng ating panubigan. Now, we move forward naman po sa patient education o kung ano po ba ang kailangan nating malaman bilang isang pasyente. So first off po, we have to know that we have to maintain the cleanliness and sterility of the birthing area. So what does this mean po? Ibig sabihin ay hindi lahat ay basta-bastang pwede makapasok ng birthing area to prevent any occurrence of infection or contamination that may harm the mother, the child, and even the healthcare professionals po. Next, we have to know that proper patient positioning is important in order to facilitate better delivery. So ano po ba ang pwedeng gawin ng ating mga manganganak na? So pwede po silang mag-squat, lumuhod, o hindi po kaya'y dumapa para po mas mapadali ang proseso ng labor. And lastly, the patient has to know that they have every right to inform the nurse or the healthcare professional kung may nararamdaman po silang masakit sa kahit anumang parte ng kanila. To summarize everything that I have discussed, I have mentioned po that there are different mechanisms or observations that one can make during childbirth. Second, there are different alternatives and methods that the pregnant mother may consider during labor. And finally, there are certain information that the patient should know before giving birth. Want to know what happens to you and your baby next? Watch out for more.
Okay, Mami, isang push na lang po. Baby out. 12:05 a.m. Finally, the baby is out. Congratulations, Mommy. But do you ever wonder what your doctors, midwives, and nurses do right after your baby is out? Medical professionals follow a strict protocol once your baby is out. This protocol is called EINC, or Essential Intrapartal Newborn Care. This protocol constitutes a series of time-bound, chronologically ordered standard procedures that your baby receives right after birth. The EINC was developed to help solve the Millennium Developmental Goal number 4, which aims to reduce child mortality. And with EINC being strictly followed here in the Philippines, this will reduce the high rates of child mortality that our country is facing. On December 7, 2009, the DOH issued an administrative order to implement the EINC protocol with the goal of rapidly reducing the number of newborn deaths here in the Philippines. The implementation of this protocol has the potential to avert approximately 70% of newborn deaths that are due to preventable causes such as birth asphyxia or a lack of oxygen in the brain and severe infection or what we call asepsis. As what I said earlier, the EINC protocol follows a time-bound and chronologically ordered standard procedures that your baby receives right after birth. Let's start with the first procedure. As you can see on the upper left picture on the screen, the doctors are thoroughly drying off the baby. This procedure stimulates the baby's breathing after delivery. Remember, a crying baby is a breathing baby. So, if you hear your baby cry, it is a good sign that your baby is breathing. Next is the picture on the upper right. As you can see, the baby is placed on the upper abdomen or near the chest of the mother. This procedure is called the unang yakap. Not only that this helps your baby from being cold with your body heat through skin-to-skin contact, but this also initiates your first bond with your baby right after birth. Next is the umbilical cord clamping and cutting. While your baby is on your upper abdomen or near the chest, the doctors will clamp the umbilical cord when it is no longer pulsating. The proper clamping and cutting of the umbilical cord prevents your baby from having anemia or a lack of red blood cells that carry oxygen to the baby's body tissues. While this is being done, the mother will be injected with oxytocin in her arm, which helps her uterine to stop bleeding through contraction. And for the last time-bound procedure is the immediate latching on and initiation of breastfeeding. Some mothers may think, is the first formed milk safe for my baby? In fact, it is.
The first milk produced by the mother is called colostrum, and this colostrum is loaded with immune, growth, and tissue repair factors that helps develop your baby's immune system. So how will you know if you are breastfeeding the right way? The baby's lips must be turned outward like a fish slips. Make sure that your baby's chin is not tucked into their chest. You'll know that you've got a proper latch if your baby's chin is just like what's seen on the picture. After all these procedures, identifier such as a tag is placed on the ankle of the baby. It is not placed on the hand because the metal clasp may cause scratches to your baby's face. If we have our time-bound procedures, we also have our non-time-bound procedures. Non-time-bound procedures are done within 6 hours of birth and should never be done to compete with the time-bound interventions as it is our main priority. It is recommended to give these procedures after the first breastfeeding because the bonding of the mother and the baby is more important. On the upper left picture, you will see the baby is receiving eye care. Doctors put ophthalmic ointment to the baby's eyes to prevent the baby from having
Pink eyes.
this is done to all babies whether you gave normal spontaneous delivery or cesarean delivery. Next is the vitamin K, BCG, and hepatitis B administration. Vitamin K is administered on the thigh of the baby. This is given to prevent your baby from bleeding and hemorrhaging. BCG is given to prevent your baby from having meningitis and tuberculosis. Hepatitis B vaccine is given to prevent liver infections. Our next non-time bound procedure is the physical examination. Doctors assess your baby's physical features. They don't assess if your baby is prettier or more handsome from others, but rather they assess for birth injuries, malformations, or defects. Lastly, cord care is being done to your baby. Doctors clean the surroundings of the cord and leave the clamp on until the cord dries and falls off on its own. There are some procedures being done by parents that are unnecessary to promote their baby's health. Routine suctioning is an unnecessary procedure, most especially when there are no more secretion blocking on the baby's mouth or nose. However, if that occurrence happens, immediately call your doctor. Early bathing or washing are also being done by some parents. Even with the right temperature of water, early bathing may cause your baby to drop their temperature, leading to a higher risk of infection. Another important note to remember is when your baby has these white cheesy coverings on her body, it is important not to remove them. These cheesy white covering is called the vernix caseosa, and these have antibody components that helps prevent your baby from having infections. Foot printing or having your baby's foot printed on a paper is not necessary since it is not accurate for identification of the baby. However, if parents would like to do so for their documentation or what we call the baby book, then they may do so. Another unnecessary procedure is applying alcohol or betadine and bandages on the cord stump of the baby. This procedure delays the drying process of the cord, which makes it more prone to infections. When your baby's cord stumps are dried, they voluntarily fall off from the baby's belly. Upon discharge, you should also know when to return to the hospital. You should immediately call your doctor and go to the hospital or health facility if your baby is having jaundice or yellowing of the soles, has been having difficulty in feeding, has been having convulsions, only moves when being stimulated, having difficulty in breathing, or has a temperature of higher than 37.5 degrees or lower than 35.5 degrees Celsius. It is also important to have follow-up checkups to monitor your baby's health now that they are exposed in our environment. Bring your baby to the nearest health facility or a health facility of your choice based on the days being shown in the presentation. Lastly, have your baby take the newborn screening test as mandated by the RA number 9288 or the Newborn Screening Act of 2004. This test must be done to all newborns to detect early possible permanent disabilities. However, if the parents refuse to have this screening test on their baby, they must sign a refusal form for proof and documentation. And that, ladies and gentlemen, is the EINC or Essential Intrapartal Newborn Care or what we call unang yakap. Yakap ng ina, yakap ng buhay. But before this video ends,
Childbirth is really an amazing process, right guys?
Tama ka dyan, Kay.
Marami talagang kailangan pagdaanan ng ating mga nanay.
I couldn't agree with you more, guys. With that in mind,
Let us not forget to thank our mothers for the love that they continue to shower us with.
Hopefully, what we have shown to you today about labor and delivery does not only guide you as expecting mothers, but also may this serve as a reminder that we should always appreciate the sacrifices of our mothers.
We thank everyone for joining us today.
And we hope to see you on our next video. Bye!